Okay.
Okay. Alrighty. So today we're interviewing Ms. Julia Kaufman-Jancy about hospice nursing. So thank you for being with us. So our first question is, tell me a little bit about your responsibilities as a hospice nurse.
Right now, I'm one of the nurse educators. So I was a hospice nurse for 8 years. A lot of my responsibility was visiting patients, managing their cases. I did symptom management. Part of that was following protocols for different symptoms that they had. We also key into safety issues in the home. Part of teach the family how to keep that patient safe and from falling is the big issue all the time. A big responsibility for the case manager also is watching and keeping track of medication reconciliation. As our patients' condition declines and their disease progresses, medications that were appropriate early in the disease process are no longer appropriate anymore, or you might start seeing more side effects because their kidneys and their livers aren't processing meds as fast, or metabolizing meds as fast. So that's part of the case. That's a big part of what case managers do is symptom management, med reconciliation, patient safety, and then support for that patient and family. We provide a lot of anticipatory education and symptom management, training them for what's coming next, the decline that they're seeing in the patient, and that disease progression, and what they need to know to provide good care for that patient. That's a lot of our job. And it usually when we make visits to our patients, we usually see them about once a week. Sometimes if they're having increased symptoms or safety issues, we may be seeing them 2 or 3 times a week. That would be the nurses. We also, as a team, we work as a team, and so we have hospice aides working with us. They may be in the home 2 or 3 times a week doing personal care. We collaborate. I don't know how much you understand about the team. Do you understand what a hospice team, like who's all on it? Okay, you know what, maybe I should back up. Thank you for providing that visual feedback. Okay, we work as a team, and our team is medically directed, and on that team is going to be a case manager who's an RN. There's usually an LPN that works with that team. Also, there's going to be a social worker, a chaplain, hospice aides, and you have your team leader also. And they provide the care for that patient and family. Where in the hospital or in other settings, the patient is like the center of care. In hospice, it's the patient and the family, or the caregivers. If the patient is in the nursing home, we include the nursing home staff as a part of the patient's family because they are the caregivers. Does that make sense?
Yeah.
Yeah.
So while the nurses are seeing the patient for symptom management and education regarding safety and meds and that kind of thing, the social worker and the chaplain are also there supporting that patient with how they're coping with their illness. And the chaplain will be involved with the patient care in terms of the spiritual aspects of the disease progression and how that is affecting them, also with existential suffering. And nobody really quite agrees on what existential suffering is, but it's kind of like what's left when you've addressed everything that's physical and you're like, there's something else going on. That's that existential piece of it. So,
okay.
Yeah.
So what educational preparation do you have for your position?
I'm an RN. I've worked in a lot of different areas of nursing. Mostly, I started out in med-surg and then went to the intensive care unit, caring mostly for cardiac patients. And then at some point, decided I really wanted to see what it looked like to take care of folks at end of life outside of the hospital, and perhaps with a more holistic focus and more support for the patient and family. I found a lot in the intensive care unit. We were helping people get better just to get sick again, and they would send me back. So I have a bachelor's degree. That's not required. Yeah. And I'm also certified in hospice and palliative care nursing.
Okay.
So it does require a certification?
It does not.
Oh, okay.
But we highly recommend it.
Okay.
Our agency would like to see all of our nurses hospice and palliative care certified. They offer us a 75% increase in our per hour.
Oh, wow.
Yeah.
Pretty big.
So that works out. I usually do the math for the new orientees because that's what I do now is I'm teaching them how to be hospice nurses. And that's $1,500 a year. So, in 2 years, that's $3,000. That's a really nice vacation.
Yeah, that's true.
Yes, it is.
Yeah.
Alrighty. Do you two want to ask questions?
I'm sorry?
Yeah, I can go next. Okay, so my first question is, what could you maybe tell us like the main difference between hospice care and palliative care? Because I know sometimes that's kind of confusing.
It is confusing. Now, palliative care is care that's directed towards, it's team-based, like I talked about. You have a physician, nurses, social workers, chaplains. It's team-based also, and its focus is managing symptoms and supporting the patient and family, and helping them live as well as possible. Hospice care is palliative care the last 6 months of life.
Oh, okay.
Yeah, hospice is palliative care, but palliative care, you can have that
throughout the whole
course of care. Yeah, when someone's diagnosed with a serious illness, it would really be good if, I don't know, with your family members, you got grandparents or whatever, encouraging them to get a palliative care consult. It's just really nice support for those folks.
Yeah, that makes sense. Okay, and then I just have one more. So, what is your least favorite thing about working in the hospice setting?
My least favorite?
Yeah.
Oh, okay. That's a hard one.
Be a hard one, yeah.
Because I think this is the best job I've ever had.
Really?
That's why it's really hard. Yeah, and I've been a nurse a long, long time, and worked in a lot of different areas, and it is the best job I've ever had. So that's really hard. The least favorite thing, I would say, I know it's really necessary to do thorough documentation. I know that I need to document well so that my patients get the care they need, and everybody else on the team knows what I've been doing and what my thoughts are and what the patient is needing. But just that piece of it, yeah, I could do without it.
Yeah.
But I know it's very necessary, so yeah.
Okay, thank you.
So then I guess I'm going to follow that question up with, what do you think is the most rewarding aspect of being a hospice nurse?
I think the most rewarding aspect is being able to help a patient and family live really, really well in the time they have left. That's probably the most rewarding thing of all. And to know that they had time, that we gave them good time, that they were comfortable and they knew what to expect, so they weren't anxious. That kind of thing is probably the most rewarding thing.
Okay, and then I have one more question. How would you deal with a challenging patient or home environment working in hospice care?
Well, that's the beauty of having a team. Okay, the first thing I would do is probably do a really thorough assessment, try and hear what their needs are. Maybe they're challenging because we're not hearing them. So trying and exploring what their hopes and wishes are, and not, it might be that we have a plan of care that we think is pretty good, but it's not theirs. So trying to figure out that piece of where the trouble is, and then talking it over with the team, having a mini team meeting. We do meet as a team every 2 weeks and talk about every patient's care. But that would probably, if I was having a challenging patient, I would probably have a mini team meeting with just the nurses and social workers, chaplains who are actually in that home, and seeing if we can't come up with a plan together. Sometimes it's helpful to have another team member's perspective on an issue. Sometimes they've told a social worker one thing, but they haven't really told anybody else, and they have that one piece of the puzzle. So yeah, we'd work as a team. That's what we do.
Okay. So, does anyone else have anything to add?
I don't think so.
Yeah.
Okay.
Thank you so much
Thank you so much.
You're welcome. And I'll tell you, I meant it when I said this is the best job I've ever had. And I've worked in a lot of good places, in a lot of good hospitals. Highly recommend it. But I also recommend getting some really good experience before you come here, because you are out there. You are the eyes and ears for the physician.
Mm-hmm.
But oftentimes you're there, and although I have my phone with me all the time, there's nobody else I can quick bounce something off of, like, hey, come listen to this, or come take a look at this. I have to call somebody, that kind of thing. So you really do have to have good assessment skills. So carry on, get the best education you can. I'm at the end of my career, and it's really cool to see you all at the beginning of your career. So
Yeah, we're excited.
I'm excited for you.
Yeah.
Yeah.
A real job.
Yeah.
All right, well, thank you.
Thank you.
Thank you.
Have a great day.